Okay, welcome everyone to this panel hosted by J-PAL Africa with affiliated researchers from the University of Michigan, UC Berkeley and Oxford University. My name is Laura Poswell and I'm the Executive Director of the Africa Hub of J-PAL. J-PAL, or the Abdul Latif Jameel Poverty Action Lab, is a global research center which aims to reduce poverty by ensuring that policy is informed by scientific evidence. We work with affiliated researchers from around the world who use randomized evaluations as a tool to assess the impact of development policies and programs. Today we'll talk about theme 1 of this year's EIS, Fast, Good and Cheap, Choose 2. But our panel is entitled Choose 3, using rapid RCTs to inform policy in Africa at the time of COVID. And we're really excited to be discussing a number of exciting studies that our presenters have been embarking on during this difficult time, covering health, education, and poverty-targeted responses to this time of the pandemic. They will share how they've been working to collect data under difficult circumstances and to work with government partners to inform their decisions. And they will think about and think with us about how to manage the trade-offs between quality, time, and cost. The agenda will be a brief introduction, presentations from our panelists, and then a moderated discussion with some concluding remarks. So let's get started with some introductions. I'll hand over to the presenters to introduce themselves. Dean, if you could start, let us know your university affiliation and some key areas of interest.
Hello everyone, I'm Dean Yang. I'm a professor at the University of Michigan, and my research is broadly on health and development, migration, and financial decision-making, microfinance.
Yep, hi, Josh Blumenstock here. So I'm at UC Berkeley in California, and I do a lot of work at the intersection of computer science and development, in particular thinking about how new data sources and new computational methods can be useful in development research and policy. Thanks.
Hi everyone, Noah Mangrist here. I'm the co-founder of Young Lab, which is one of the largest NGOs in Botswana, and then also a fellow at the University of Oxford, and my research is focused on human capital and the intersection with development. Great to be here.
Thank you again, J-PAL, for organizing this session. Very happy to share with you a certainly fast and cheap and hopefully good study of ours going on in Mozambique. This is our research team, and broadly we're aiming here to address the COVID-19 pandemic by finding a way to improve people's social distancing behavior, encourage more people to do social distancing. We're doing this study in Mozambique, and in particular, if you're familiar with the Mozambican context, we're working in Sofala province, Manica province, and Zambezia province, across 76 communities that we've been surveying since 2017 in the context of a randomized controlled trial of a very large-scale HIV/AIDS program. In the context of COVID, we decided to do this additional study within the same study population that we've been following since 2017. That the fact that we were already in touch with these households gave us the opportunity to reach out to them by phone in the context of the COVID-19 pandemic to do the work that I'll be describing to you. So the broad motivation here was to encourage people to do more social distancing to help fight the COVID-19 pandemic. COVID-19 first had its first official case based on testing on March 22nd, just a little bit after the rest of the world started locking down, and we had field staff in the field interacting with people in our study communities at that time, who we immediately instructed to start taking social distancing measures themselves. And we got some immediate feedback from our field staff saying that people they were interacting with in communities, local officials, households, were taking offense that they were refusing to shake hands and not wanting to stand within 2 meters of them. And this led us to think, well, perhaps there's something we can do to accelerate the shift in norms towards accepting social distancing, and that way potentially encourage people to do more social distancing themselves if they start to believe that the norm is shifting in that direction. Some initial data that we collected suggested that indeed, while there was actually strong support for social distancing in communities, people didn't tend to recognize this. So what we're showing here in this simple graph is that 98% of people we surveyed support social distancing, but they believe that community level support for the social distancing was only 69%. They believed only 69% of people felt that people should be social distancing. So this gap between perceived support for social distancing in community and actual support was what we were seeking to address, basically by informing people, simply informing people that in fact the social norm in support of social distancing was in fact, essentially 100%. So that's the treatment that we investigate in this, in this very fast, cheap, and good RCT. We simply inform people that nearly everyone in their community supports social distancing. This is a randomized controlled trial, so we do this for a randomly selected subset of individuals that we contacted by phone. So this is the study timeline. We're sort of overlaying the study timeline on the horizontal axis here against, on the vertical axis, the number of COVID-19 cases reported in Mozambique. So we very much conducted this study as COVID-19, the recognition of COVID-19 via testing was ramping up. And those of you who conduct RCTs will see that we conducted this in a very sort of fast time frame for most RCTs. We did a first round of data collection to understand the social norm here in July and August. Then we did what we consider our baseline survey in August through October, and then a final round of collecting end-line survey, all by phone from October to November. Every person, basically, we did the baseline and the end-line on a rolling basis, so whoever was surveyed first at baseline also got surveyed first at end-line, and we had about on average, a 6-week gap between people's baseline survey and their end-line survey, with a minimum of a 3-week gap. Just some summary statistics again. By the time of our baseline survey, the social norm had shifted, or people's perception of the social norm had shifted. From 69% to 80%. Beliefs that 80% of people in the communities supported social distancing, but it was still, quite a gap away from the 99% true support of social distancing. We also innovated here in sort of measuring people's social distancing behavior. So we have a measure of social distancing that takes into account both people's own self-report of whether they're social distancing, as well as the report of others who we called, surveyed, and asked about the social distancing behavior of other people in the community that they knew. So everybody in the community, just about everybody in the community was known by others who we were surveying. So we actually took this opportunity to ask people, have you, in order to measure person A's social distancing, we surveyed person B also in the same community about whether person A was social distancing. And some just our initial summary statistics here are quite revealing. Even though 95% of people self-report that they're social distancing overall, when you ask them about specific social distancing behaviors, about whether they're shaking hands with people or staying farther than 1.5 meters from people, only 36% of people appear to be social distancing, even according to their own self-report. And then when you ask other people in the community whether the respondents are social distancing, you only get about 22% of the respondents being reported by others being social distancing. When you combine all of this information, it looks like only 8% of people in the sample are actually doing social distancing when you combine according to their own reports as well as the reports of others. So there's actually, one of the first things we learned in this study, even just at the baseline, was that there's a very, very large gap between people's self-reported social distancing and their actual social distancing. So that's the first big thing. Since this is a very short presentation, I'm just going to jump directly to our results. We actually find that this intervention, the treatment that in which we inform people that the true level of support for social distancing in their communities is nearly 100%. This does move people's perception of the norm of social distancing in their communities, but on average, across all communities we're looking at, it basically has a zero effect on people's actual social distancing behavior. But it turns out that zero effect masks a substantial amount of heterogeneity across communities. So basically what we're showing here in this one last graph is the estimate of the treatment effect of our social distancing norm correction treatment on social distancing as measured by the indicator I described in the prior slide across each of these 7 districts in our study. And it turns out that in one district, the effect is quite large, 9 percentage points off of a base, which is a 75% increase over the base level in their community. And in all other communities, it's actually close to 0 or in fact negative. And what appears to be explaining very strongly the heterogeneity in this treatment effect is the level of cumulative COVID cases that have occurred so far in that community. So basically, it looks like the more COVID cases there are in the community, the more positive is the treatment effect. And we're thinking theoretically about this. Basically, we think this reflects the fact that at low levels of COVID cases in a community, people respond to this social norm information by actually reducing their own social distancing because they're free riding more in other people's social distancing. They believe they can free ride more in other people's social distancing and don't perceive a huge threat from COVID in their communities at the moment. But once COVID cases start to rise in a community, then actually the self-protective motive for social distancing starts to dominate, and people start to social distance more in response to the information that other people support social distancing. So that's a quick summary of what we're doing. Very much looking forward to the other presentations and to the conversation.
Great. Thank you to the organizers for including me in this program. I'm going to present what are very preliminary results from an ongoing project to provide cash transfers in Togo. And echoing Dean's sentiments, it has objectively been very fast and cheap, and we also think it's good, but you can, of course, judge for yourself. So as a little bit of context, in response to COVID-19, there have been over 100 targeted social protection programs launched in low and middle income countries. And of course, there's a large literature that documents the sort of targeting errors of inclusion and exclusion that result from different targeting mechanisms. And it seems reasonable to expect that in the context of a pandemic, these targeting errors would be exacerbated. There's limited opportunity to update social registries, or worse, in the case of Togo, as you'll see in a second, the government was forced to mobilize a new social protection program in the absence of a registry designed for that purpose. So what I'm going to focus on is the targeting of Novisi, which is Togo's flagship anti-poverty program. The Novisi program is remarkable in a lot of ways. It was scrapped together in just a few weeks by the Togolese government to provide unconditional cash transfers, which were delivered via mobile money to over 500,000 beneficiaries. So this program is great in the context of COVID. Everything is digital and contactless, the distribution of these payments. But as noted, at the time when the program was launched, there was no universal social registry with proxy means tests or other information that could be used to target the program. So what the program administrators did was sort of ingenious. They used a recently updated voter database that had information on people's home location as well as their self-declared occupation, and used that to target informal workers in the major urban areas of Togo. And so while this was a very creative and resourceful solution, as you can see on the right, it turns out that this targeting mechanism actually turned out to be mildly regressive. So our analysis, which was based on a nationally representative household survey that was done before the pandemic, suggests that program beneficiaries were actually slightly wealthier than non-beneficiaries. So what we've been working on is helping them design and expand this program into rural areas. And so our work is basically, it focuses on how new sources of digital data, in particular data from satellites and mobile phone networks, can improve the targeting of social protections in Togo. So there are two main aspects to this work. The first, which you're looking at right now, is to help the government identify the poorest villages, or in Togo they're called cantons, in the country, using high-resolution poverty maps that are constructed by applying machine learning to satellite data. This was an important step because at the time COVID arrived in Togo, the government had no equivalent poverty maps that would make it possible for them to do geographic targeting below the prefecture level, which is sort of the equivalent of a state in Togo, which is a very large region. So, in keeping with the theme of this panel, these maps were constructed very quickly. We took existing nationally representative household survey data that the government had collected in 2018 and 19 and used those to train a machine learning model that took publicly available satellite imagery to construct a high-resolution poverty map that looks like this. And so based on these estimates, the government identified their target population of people living in the 100 poorest cantons in the country. The second step and the second innovation that we're testing and evaluating as we speak is the use of data from the mobile phone companies to prioritize the poorest subscribers within those 100 poorest cantons. So this builds on prior work that I and others have been doing over the last several years that basically shows that wealthy people use their phones differently from poor people, and machine learning algorithms, when given the data they need, can differentiate between wealth and poverty. And so intuitively, the idea is just that wealthy people, they make international calls, they have data plans, they use mobile money, they spend more money per month on airtime than poor people. And machine learning algorithms, which are just sophisticated technologies for pattern recognition, can pick up on these patterns. So again, in keeping with the theme of this conference, the way we, or this panel, built and trained these algorithms was to conduct a nationally representative phone survey, relatively large, but this was all done in about 10 days in summer of 2020, and use this to provide the training data for one of these algorithms where we matched the responses of people in the phone survey to mobile phone metadata that came from the operators, and use this to identify the poorest subscribers who are then prioritized for assistance. So in a sense, you can think of this as like a very high-dimensional machine learning-based proxy means test, where instead of using a bunch of assets, we're using data that on mobile phone use. So again, this is a very short introduction. I'll just jump straight to the punchline results. What we see right now is that when we evaluate these different approaches to targeting, so down here you can see on the left, if the government had expanded their occupation-based targeting in rural areas. Another counterfactual is if the government had done a geographic targeting approach where they purely targeted the poorest regions. And then on the right, what happens if you look at the accuracy of targeting using this mixed method satellite and phone-based approach, is that this phone-based approach is expected to provide benefits to nearly twice as many of the poorest citizens as a program targeted using, say, occupation. So based on this evidence, the government, in partnership with the NGO Give Directly, is now using this particular targeting mechanism to expand social protections to about 115,000 of the rural poor. We're currently, like literally right now, in the field conducting an in-person household survey to more rigorously evaluate these methods and also to compare them to other standards that were not available to the government of Togo, but that are interesting comparisons like a proxy means test or a community-based targeting exercise. So as you can see, this work is still very much, oops, my camera fell, but the work is still underway. Any feedback is appreciated. I'll stop talking now and fix my camera. Thanks.
So today I'll be presenting work called Schools Out, Experimental Evidence on Limiting Learning Loss Using Low Tech in a Pandemic. And this is some of the first evidence on limiting learning loss during COVID. We ran a rapid trial, and I'll jump into those details. This is with co-authors Peter Bergman at Columbia and JPAL, and Moitepi Macheng, who is co-founder of Young Lab, one of the largest NGOs in Botswana, and also the chairperson of the National Youth Council in Botswana. So we'll just dive in, as some folks know, and just to share, this has been a historic crisis for education worldwide. Over 1 billion children were forced out of school when COVID struck. What you can see here, this is from UNESCO data. The dark blue is school closures countrywide, the light blue partial, and you can see this happened in most countries. Schools just shut down. So how do you reach people and support them to provide education? And I think there's some parallels between our presentations here. We felt low tech was the approach that had a lot of viability here because there was high access and it was low cost. So when we say low tech, we're referring to mobile phones. And what you can see here in this graph, this is from the Center for Global Development, is in the teal is internet access in upper middle income to low income countries, and it's around 60% or below, sometimes below 20% in low income countries. But in pretty sharp contrast in the bright red, mobile phone access is extremely high. It's around 80% in low income countries and above 90% in upper middle income countries. So we thought this was a way to actually reach people and support distance learning during this crisis when schools were closed. So we ran a rapid trial in Botswana. We collected phone numbers very quickly, initially 10,000 actually numbers, and eventually we enrolled 4,550 households into this trial to provide distance learning. What you can see here is a map of Botswana, and in these orange kind of density plots here is where folks are concentrated. Botswana is 80% desert actually, so this is actually most areas that are populated in the country, and even in quite remote areas. So we actually managed to reach most people, which gets to this high access, low cost dimension. The trial itself, the distance learning program, was actually very simple. On the left-hand side here, you can see simple SMS messages, which went out once a week. They were very simple problems, sometimes word problems like you have 257 pula, how many hundreds, how many tens, how many units. Very simple material going out once a week. And then on the right-hand side was a second treatment arm, which actually added a phone call. So these were 20-minute calls from a virtual tutor, essentially just walking through these problems, supporting, adding additional problems. So those were two treatment arms. And then into this was actually cross-randomized targeted instruction. So what that was using baseline learning levels to actually then say the addition kids are going to get these SMS problems and these calls. Subtraction kids who know subtraction are going to get these calls. And so trying to make that even more precise through the phone. So that was the trial. What were the results? What you can essentially see here is the SMSs on their own on the far left here do not have an effect that's significant a few months later on a few proficiencies. So average level, this is from recognizing numbers to division, place value in the green and fractions in the blue. But the calls and the SMSs are quite effective. This is standard deviation gains. This is 0.12 standard deviation gain on average level, 0.14 for place value, and 0.075 for fractions. It's actually quite a higher order competency. These were really remarkable results, actually. We were quite surprised by these on such a rapid notice that it had such a big effect. And just to put this in context, in education, anything above 0.1 is considered pretty big. What you can also see here is the not targeted results are not as effective, and targeting actually is on average more effective across these proficiencies. We wanted to also measure whether these learning outcomes were reliable, because we actually had to measure learning via phone, which is actually quite unusual and hasn't been done as often. And so we did a few things. I'm just going to show one example here. One concern is that a lot of these effects might be effort effects, and there's been some good research on that showing that effort on the test alone can result in higher proficiency. So we had a real effort task versus cognitive skill task. So the real effort task was a riddle, actually. So, today's Friday, the day before yesterday, what is that? So it actually was not a kind of numeracy proficiency, but just kind of thinking through. And we could try to tease out differences on effort and motivation from more core proficiency cognitive skills, you could argue. And we actually see here that the p-values in the brackets are quite large, so we're not seeing big effects on effort, whereas in learning in the phone and SMS group, we're seeing quite small p-values, very significant effects there. So it looks like most of it was cognitive skills, and we did a bunch of other tests as well to try to layer in some reliability assessments in this innovative measurement approach. So a few takeaways. This was some of the first experimental evidence during the pandemic to address learning loss. And this was really critical. We battled with this. We said, should we just get something to everyone, or should we run this as a trial? And where we landed and in our conversations with the government was there was actually enormous uncertainty, and we really wanted evidence, so we didn't throw the kitchen sink at this, actually. So we knew which direction to go. And so actually this trial proved really critical to be able to prioritize and say this approach can work better than others. In terms of cost effectiveness, in the spirit of cheapness, this is pretty cost effective, about $100 per 0.89 standard deviations. Again, standard deviation sometimes hard to put in perspective, but this is considered pretty good in the education literature. And interestingly, this actually forced a bit of innovation. So this idea of targeting instruction by a child's level is something that's been done, teaching at the right level in many contexts through many randomized trials, but doing it through the phone has actually not been tried as often. We tried it, actually worked. We were kind of surprised. So We had actually been doing it the sort of old-fashioned way in a classroom setting pre-pandemic, but now this seems like another promising avenue. And the final 2 points here is governments do spend enormous amounts of money on ICT, information communications technology, but by and large this often goes to things like computers and tablets, at least in the context of education, and the evidence there is not very strong actually. So EdTech is quite a mixed literature, especially in low and middle income countries. And so perhaps trying some of these low-cost, high-access approaches like mobile phones could be a way of having a more cost-effective approach here. And the final thing is, yes, school closures were really unprecedented in scale during this crisis. This actually made us reflect and realize that school closures do happen in other settings as well, like weather shocks, teacher strikes in fragile settings, summer breaks. Actually, there's often this need to support education when schools are closed, and this could be an approach to think about that. There could be many others. We actually had not thought about that as critically pre-pandemic. So I'll just end with a timeline to emphasize this point on speed and that this can actually happen relatively cheaply and quickly. This actually started in April. The first trial in Botswana. There was a midline in May, about 4 or 5 weeks later. It was looking promising then. We actually then did a follow-up in July just to see if the effects were holding. And when they were, we actually started to work with a bunch of partners to explore replication trials across 3 to 5 countries. And those actually saw pilots start to happen in September and October. In November, December 2020, we launched a trial in Kenya with a public-private education provider, New Globe. And then in January of this year, actually, we launched a trial in Nepal with the World Bank and the government and Teach for All. So 3 trials, 3 countries, 15,000 households, 12 months. So who says RCTs can't happen fast and have proved really critical, actually, in this crisis. So thank you, and looking forward to the Q&A.
Great. Thanks, everybody, for those fantastic presentations. It's so exciting to hear the work that's taken place at quite an unbelievable speed. And that's where we're going to start, which is thinking about the theme of fast. And obviously, in the context of the pandemic, we've had to move much more quickly than perhaps we ever thought possible to answer some of these really important policy questions. And I'm interested to hear from you what you think the preconditions were that were necessary to enable you to do this kind of research, both from a data collection standpoint, but also from a kind of sophistication of the questions you're asking and clearly building on from past work. And I suppose we have a general question always if RCTs can ever be fast enough to inform policy. So maybe some reflections on what you've learned as you've gone down this road during this time. And maybe, Dean, I'll start with you to hear your thoughts on that.
Sure. No, that's an excellent question. There was certainly a really important confluence of events that allowed us to do this, to move so quickly. Certainly, one of the most important things was the availability of funding. Many organizations, plenty of funding organizations, to their, really amazing credit, mobilized really quickly when the pandemic started to deploy resources to studies like this. JPAL deserves pride of place, in that group, and about a quarter of our funding for the work that I described came from JPAL. We also got some funding from IPA, as well as from about a quarter of our funding from internal sources at University of Michigan. So my university also moved quickly to make resources available. The other thing that allowed us to move quickly was just a fortuitous circumstance that we had a study ongoing. We had a study sample that we had already consented in the past for doing ongoing survey work. We had people's phone numbers, and we had a field team on the ground in Mozambique who could move quickly once we formulated these new surveys. And we had all of the field team all had equipment on the ground, tablets they normally would have used for in-person surveys. We redeployed those to basically be the data entry devices on which our enumerators entered the survey responses while they were calling respondents on the phone from their own homes. So we definitely couldn't have, this isn't really something that's replicable in the sense that, we couldn't have pre-planned to have had a team in place when COVID happened. But, we were able to capitalize on the availability of our team in place on the ground, when COVID happened, and we were able to get additional funding together from JPAL, IPA, and other sources, to make it happen.
Great, thanks. And no, maybe you can talk about your experiences.
Yeah, definitely. I agree with everything, actually. I wasn't originally gonna speak to those points, but I wanted to give a big and emphatic, I want to reiterate that too, because you can't do it without the team and it's just not possible, right? So I actually think that's critical. And funders who can move quickly, absolutely. And I think there's not enough of that. We were really lucky that we had that as well, actually. So JPAL, Mulago, Marshall, folks who moved very quickly. A team, we had 100 staff also throughout the country. We actually collected 10,000 numbers in 3 days. It was just insane because everyone was in the schools so they could collect these numbers. So it just wouldn't have been possible without that. So I'm actually so glad that that's come up because that's the key enabling condition. I was going to say also that can RCTs happen fast? Yes, actually. I think they have. I was thinking about this. There's nothing inherently slow about randomizing, right? Like you can randomize quickly. There's nothing slow about that. But for some reason, there is this perception that RCTs can be slow moving. But I actually think that's more the use case, really. Rather, there's nothing technically true about that in terms of randomization. And in fact, randomization is used in the tech sector all the time to do things very quickly in A/B testing, right? So it's actually not the randomization. And I actually think in this case, we use the benefits of randomization, which gives you a causal and reliable estimate, were critical quickly because we needed to make really tough choices. We had really limited budgets, and we had to make a call on what to do, and the government had to make a call on what to do. So we wanted answers, actually, that we could trust. So I actually think this is a great use case for the value of randomization to be fast, and it's possible. So that was another aspect I was going to touch on. And the final thing I was going to say is the term of M&E, monitoring and evaluation, I think the E gets a lot of attention, evaluation, but in my view, I think the M was really critical here and could be repurposed for good evaluation. So actually, it's related pre-pandemic, we had already been collecting learning data in 4-week cycles to monitor the programs, actually. And so we had, Survey CTO downloaded on smartphones that were used to collecting this kind of data. We had a team that was used to these types of turnarounds and knew how to enter data very quickly and do data checks. And so having that kind of monitoring system that was fast already could be repurposed for the evaluations. I think the M needs to get more attention than M&E.
Awesome, thank you. And Joshua, I think over to you. I was struck by the fact that all this data existed in terms of the household data and then obviously how you use the poverty maps. And I'm interested in how much you had to do to get it into a form already that you could work on so rapidly.
Yeah, I'll address that, but maybe let me just tag on to what Noam and Dean were saying, which is that I think, and this speaks to your question, and in contrast, I think the position Dean and Noam were in, our research team didn't exist and wasn't doing any work in Togo prior to this project. And I think the only reason it was possible in our case was because there was these amazing partners in Togo with immense political will and capacity to basically move heaven and earth to make this happen. And in particular, and I think JPAL can take some credit for this, they had a very high appreciation for the value of rigorous evidence in informing their decisions. And so I think we were extremely lucky, we being the research team, to come to the table that was already set with these partners who really had this appetite and the ability to move things to make it happen. And then, by contrast, and Noam sort of maybe was hinting at this, but it's not the RCT that necessarily is the bottleneck. I think researchers are not always universally known for their ability to move quickly and responsibly. And so I think in this case, there was a desire and capacity to set basically other projects aside in order to make this work. And I think hopefully that's something we can learn from this particular crisis, to be more responsive under non-crisis circumstances. But I mean, Laura, to your question about how did the data come together, again, this really goes back to the partners in Togo and also the NGO partner Give Directly that had a ground presence to basically get everyone together. So, you know, we were very quickly in contact with people at the top levels of the National Statistical Office who were saying, like, you know, any data we have that can make this humanitarian response more effective, let us know. And so we just did like a real deep dive to say what data is here that, you know, nothing was bespoke for our purposes, but can we like use in a way that would still be useful? And then, you know, conversely, what new data is absolutely necessary in order to make this project happen? And so in particular, some of the geographic targeting could happen using existing data, using this nationally representative household survey, which we could use the fact that they had geographic identifiers to match it to high resolution satellite imagery, right? And that data is already available and we've been working for a long time. But for the second phase of the project, where we're actually targeting individual mobile subscribers, that required, you know, a new phone survey that we really had to do because, you know, we can talk about this more at length if you're interested, but machine learning algorithms are really only as good as the data that they're used to train on. And because 2-year-old data was not good enough to train this algorithm, that's why we then went and conducted, in partnership with the statistical office, this very large phone survey. So it was a mix of inheriting data that our partners were really happy to help us use, and then supplementing that with data that was really critical to make the application successful.
Great. And if we move on to the idea of good, and there we're thinking about quality, and whether we had to compromise quality in any way and cut corners. It would be interesting to hear your reflections on that. And Joshua, maybe we'll just go straight back to you because it's almost where you left off. Yeah.
Yeah, sure. I think that's right. So I mentioned this previously, but machine learning algorithms are like garbage in, garbage out. And in particular, there's a whole very robust evidence that says that any biases or errors or problems that exist in the training data, the machine learning algorithm will just replicate that at scale. And so if you're interested in designing like a nationwide policy, it's really critical that you have really, really good representative training data. And so I think, you know, this question of good and cheap, in an ideal world, we would have gone out and conducted a household survey with 20,000 households and done a full consumption expenditure module in order to ground truth and calibrate these algorithms. That was just not feasible, right? There were stay-at-home, there were shelter-in-place orders that prevented face-to-face contact. So instead, we pivoted and worked on making this phone survey as good as we can, as good as we could. And so I think, you know, in appreciation for the comparative advantages of a phone survey relative to a face-to-face survey, there are some there. Like one, aside from being fast, it's something that you can scale really quickly. So we could reach a much larger population than we would have been able to with equivalent resources for a face-to-face survey. And I think another thing is, and this is something that we're still working on very actively, is one limitation of a traditional survey is the fact that you sort of define your sample frame once, and then everyone goes out and the survey happens. With the phone survey, you can be a little bit more adaptive and responsive to the data coming in. So we were able to basically correct for biases that we were seeing in non-response. And, you know, day one ends, we analyze the data. Day two, we adjust the sample to compensate for deficiencies in day one in a way that I think wouldn't really have worked with, you know, what would be traditionally called the best measurement technology. So I think it's a recognition that good is multifaceted, and that in some circumstances, the strength of the inferior instrument can compensate for the weaknesses of the superior instrument.
That is fantastic. No, cutting any corners, any discomfort on quality or big things you learned on how to get there?
Yeah, definitely. No, at first.
Sorry.
Oh, sorry. Yeah, go ahead.
No, I didn't hear if she was addressing me, but I'm happier for you to address that question.
I'm happy to talk about corner cutting. No. I would actually echo what was just said. I think we were actually quite nervous about phone-based assessment. It had not been done before. We thought it would be we thought it would be very noisy. We didn't know if there was going to be signal there. Usually exams are proctored. There's very elaborate procedures around testing for student learning. There's a whole field, actually, psychometrics, that's sort of dedicated to doing this well. But we did it because that's what we had, and it actually forced us to innovate, and it's kind of similar. We actually learned there were some really great advantages of this approach. And actually now, the World Bank is launching phone-based assessments in 3 countries supported by the Global Partnership for Education. So it's actually kind of taken a life of its own. We actually have a companion paper just on the measurement side of this, and it's getting a lot of interest because it's actually a bit cheaper, it's a bit quicker, and it's useful for other reasons. So that was a kind of an interesting lesson from there. So at first we thought it would be less reliable, less good, I guess, in a way, but actually we found it just was fit for purpose. It had a different purpose. It's not for high stakes, but it's good for low stakes. It's higher frequency. And we introduced a few robustness tests. So I mentioned the one on effort. We have a bunch of others, actually. We had another where we randomized different problems of the same proficiency. So let's say same addition problem, but in one case it's different digits, in another case it's different digits, and you want to see that kids are getting on average similar proficiencies no matter which problem they get, and we actually found they did. And you might worry about that it's going to pass that test through the phone for a variety of reasons. So we actually tried to layer in some new robustness tests, and they held water surprisingly well, actually. And the final thing I would say is it's not perfect. So I think what we were aiming for is good enough and doable enough. So it was that intersection. Not letting, as the adage says, perfect be the enemy of the good, and we found it passed that smell test.
Great, thanks. I think I'll go for it, Dean.
The only thing I would add to this is that I think we also were able to get, good quality data, analogous to the quality level we could get in in-person surveys. But one thing that I think we probably did better than we could have done in person was actually measuring social distancing in this innovative way that involves asking other people about the social distancing of other respondents. I think that's actually, we were a bit nervous that people would not want to tell on their neighbors, basically report that other people were not social distancing. And I can't confirm this empirically, but I have a gut feeling that people might have been more willing to give us that kind of information over the phone than in person. It just feels more anonymous and more private if you're doing that over the phone than in person. So that's all I'll say on that front. I think our social distancing measure, given that we were trying to get other people to report on others' social distancing, probably worked better over the phone than it would have in person.
It's really interesting. And it's great when we're pushed, right, that we innovate and find new and better ways of doing things. Okay, so overall reflections, the same question for each of you. Of the 3, cost, speed, and quality, did you have to compromise anything? And if so, which? How did you manage the repercussions? So if you can each in 2 minutes, let us know how you feel overall about the package. And Noam, why don't you go first?
Sure. It's a great question. I would say certainly it was fast. I think that was, so I don't think we compromised on speed, actually. And actually we released this paper faster than we've released a paper we're still working on 6 years ago. So it's really been a wake-up call for me to get a move on that paper. So certainly fast. I would say good. I would say I think it's really it's quite robust, but I think there's more to be done there. So I think I think it's good enough given the amount of uncertainty. It's better. It's much better than what we know, and it's enough to make a decision. But there's more we could do there. And cheap, it's pretty cheap, but it's not the cheapest it could be. So for example, SMSs were the cheapest, but they weren't as effective. And so the phone call, we realized it was worth it, even though it was slightly more expensive. So maybe like very fast and a little bit of, mostly good and mostly cheap.
Awesome. Thank you. Dean, you're on the spot.
I think in some circumstances, and this may be one, it may be possible to be fast, good, and cheap. I think time will tell, and we'll see what other people think when they see our paper. But I think, for what we were doing, it was actually completely the right research approach to do things by phone, to do and therefore be able to do things fast. Conduct the baseline, the follow-up with just a 6-week, gap in time. So I hope that this may be, not that this would be, feasible for all studies, but for a study like ours, where we could actually do the, the baseline and inline surveys in a short 20-minute phone call each. And we had a limited number of outcome variables that we're trying to measure. This actually may be, a case where, there's no compromise. In fact, maybe an improvement over the traditional in-person type of surveys. So I think it certainly opened my eyes and pushed me in the direction of thinking about whether I can, do, fast, rapid fire phone surveys for more studies.
Fantastic. Joshua.
Yeah, I mean, I would echo Dean's sentiments and also Noam's to a certain degree. I think it has made me realize that, like, you may not have to sacrifice hugely on any margin as long as you're keeping in mind the fact that, like, it doesn't need to be perfect. It needs to be good enough and in particular better than the outside alternative. So, I think if on those margins, where would we maybe, we compromised a little bit on cost, like in conducting the survey, to a certain extent, we were willing to throw a little bit more money at the problem just to, like, have as large a sample as we could, because, we couldn't compromise on, like, there were time constraints. Like, the program had to be ready on a certain date. And so it's just like, as many people as we can talk to before that date, like, let's do it. And while I don't think we necessarily compromised on speed, I think there are lessons we're learning so that we could be faster the next time, right? Like I mentioned, that we came into Togo with no prior relationships or infrastructure. And I think, hopefully there will not be another crisis forever. But I think if another crisis were to happen, we'd be much more poised to react quickly, right? The data sharing agreements are in place, the legal frameworks are in place, the relationships, the field team. So I think one thing that we can learn from this crisis is how to, like, be better prepared for the next one, so that speed isn't such like an unknown as it was in this case.
Thank you, and I think this is going to be a great place to end. I think it's so encouraging to see the depth of work that's been done in such a short period of time. I think as well, maybe it hasn't been mentioned as much, but enabled through these strong relationships in each country that you already have. And I think we can see the policy implications of this work likely to go beyond the countries that you're in, because it's been done carefully, rigorously, and will be shared. And I think also able to think about addressing problems more carefully in the future that were maybe there in the past as well. So they aren't only pandemic or emergency relevant, but they're actually there. And sometimes we haven't been looking at them closely enough. So thank you so much to the panelists. I feel suitably inspired. I've never seen things happen so quickly before, and it's fantastic that we've learned some really important lessons from the work.